Good evening, guys. So, tonight we'll be talking about a very important topic, which is all about basic human needs. So, this is the continuation of our topic last Friday. So, let's start. So, basic human needs. Okay, what is the importance of studying basic human needs? Basic human needs, it's very much important for us healthcare provider, especially nurses and nursing assistant, because the relationship of our care to the human needs is very crucial. So when we're going to the hospital, we will encounter different needs of our patient, and we will base it uh, on this theory of Abraham Maslow's, which is basic human needs. So to reach the peak of our human needs, which is the self-actualization, we need to pass by each needs in the uh, lower part of the pyramid. So let's start with physiological needs. So when you're taking care of patient, okay, we always consider that we have basic needs, which is our physiological needs, how we are surviving in this planet. So we have to take food, water, warmth, and rest. Also, when you're going to hospital, you will see that the nurse or the nursing assistant are administering oxygen to the patient because these are one of their physiological needs. Assisting with feeding the client, assisting with hygiene and elimination, and maintaining warmth for a newborn because these are the basic or the physiological needs. So, to meet the second part of our human needs, which is the safety needs, you need to meet first the first part, which is physiological needs. You cannot reach the next step unless you meet the first need, which is physiological. So, the second one is safety needs. When you are meeting the patient in the hospital, what you can see is to make sure that the patient is safe, what we are doing before doing any procedure in the hospital, we are checking the ID band of the patient. That's why in our return demonstration, always in the pre-procedure step, always identify the patient because in that way you are making sure that you are uh, you are doing the right procedure to the right patient to make sure the patient is safe. What else? Taking defective equipment from a client environment and reporting the defect. For example, uh, oxygen cylinder is leaking. So it will be a cause of fire. So you need to report it immediately to your superior or to any concerned staff. So to make sure that the patient will be always be safe. Next is monitoring the client's safety while in the shower. So when you're taking care of a patient who is elderly, you need to make sure that the patient is will not fall because as I've told you before last Friday that this patient is very high risk with fall. So you need to make sure that they will not fall. I told you that in the hospital, fall is a mortal sin. It's a negligence from your side if one patient fall under your care. What else? Performing a safety check in the home environment for a child or elderly adult. For example, you're a home nurse or nursing assistant, you're taking care of your client in the house, like a child. Make sure that when you're taking care of this patient, make sure that there's no any things that can harm the child, like making sure that all the medicines or any uh, toxic materials is away from the child to prevent the aspiration of these materials. What else? Reporting abuse to the proper authority. So if you found patient, especially a child, being abused of an abuser, like their parents or their caregiver, you need to report it immediately. Make sure that your patient is away from the abuser to prevent another abuse to happen. So these are the things which needs safety. So the second step in the basic human needs. So to reach another need of the patient, which is the belongingness and love, it includes the intimate relationships and friends. So what are the examples that we can help in achieving these needs? So allowing visitors to visit the client. So if you see a patient which is sad and jealous to other patient because other patients receiving a lot of visitors, make sure to contact their relatives to communicate with them to visit the patient, because all of us needs these emotional needs, the attachment from our loved ones. So we need to contact them to show our patient that we care for them. Also, encouraging the family to participate in the care of the patient. So not only the patient is responsible for themselves, for their care, but also their family. Because if the patient will be discharged home, who will take care of them? We should make sure that the patient and the relative or the caregiver will learn what we are doing in the hospital for the patient. So they will be dependent. So, sorry, they will be independent when they will be discharged. Moreover, allowing religious leaders and any religious leaders to do their religious right. So we have different religion, and we should be uh, religious. Uh, what's this? We should make sure that we are respecting each religion. So if the religion says like this, or the religion follows these guidelines, we should respect them. For example, Jehovah's Witness, they are not uh, they believe that they believe that blood transfusion is not good for the patient because it will because it is not clean. So they are not allowing the patient to have blood transfusion. So even the patient will die because of blood loss, they will not allow the patient to administer blood transfusion. So if the patient or the religion uh, says that, so you need to respect that belief. Another one is being sensitive to a client particular needs as they relate to his or her role in society, like financial provider or caretaker. For example, the patient is unable to provide another medicine for her mother. So you need to respect that. You cannot insist to buy this medicine because they don't have money. So make sure to respect their rights and belief. To achieve another needs of the patient, which is the esteem needs. So esteem needs is prestige and feeling of accomplishment. So this one, the examples that we can see in the hospital. First, we need to define what is self-esteem. Self-esteem is what? It is self-image or self-respect. what you think about yourself. So self-esteem, it's very difficult to reach or to acquire because some patient or some people, they don't have this enough, or they have very low self-esteem. So what are the usual examples that we can see in the hospital of achieving, on how to achieve these esteem needs? So promoting positive self-image after surgery. For example, your patient have breast removal surgery because the patient has cancer. So the patient, especially the female patient, uh, their body image is disturbed because of this surgery. So you need to make sure that you encourage them, you have psychological support, emotional support to make sure that you boost their esteem. Also, you encourage an individual progress in rehabilitation. If patient has stroke, the patient will not do the previous activities that he or she is doing. So you need to encourage him, okay? Because he will think that he's useless, he's vegetable. So make sure to encourage your patient to boost her or his esteem. The peak of the pyramid is the self-actualization. So self-actualization is the highest need, human needs, the highest basic human needs. So only people who are self-actualized or self-fulfilled will meet this. This is achieving one's full potential, including creative activities. So who are those people who can achieve this one? Those people who are fully educated, fully educated, has a better job, has a happy family, or has a lot of friends. And also, you can also see this in, I mean, how the patient will achieve this, what are the things that you need to do to achieve this self-actualization needs is always acknowledge the accomplishment of an individual. So some patients, they will verbalize to you that their parents or their families doesn't acknowledge their achievements. So as a healthcare worker, you are the one who can acknowledge their work, their hard works, their achievements. So they will have this self-fulfillment or self-actualization needs. As human beings, we are bound to have this self-actualization in the near future. So so that we will have a happy life. So these are the basic human needs, which is the theory of Abraham Maslow. So let's go with another term, which is culture. So culture is very vital in our care for the patient. Why? Because some patient or patients have different cultures, beliefs, and customs. So we should respect all of this. This is called cultural awareness. Cultural awareness is respecting each patient or each individual beliefs, practices, and customs. So for example, if one patient believe in traditional medicine like the Chinese or the Asians, so make sure that you respect what they believe, because this shows how you are understanding their situation and understanding their culture. Next is spirituality. What is spirituality? Spirituality is a belief in something greater than oneself that helps a person assign meaning and purpose to life. You will encounter a lot of patients with different religious belief. So there's Muslim, there's Christian, there's Buddhist, and other other religion. So as nursing assistant, we should always keep in mind that each patients have this different kinds of religion. So what they believe, we should always respect it. So this is the end of the topic of our last topic of the continuation of our lesson last Friday. So next, we'll go to communication. So, communication. Guys, what do you think is the importance of communication for you, for you, for the patients, and to other healthcare or allied healthcare workers? So, importance is communication is very important for us, especially patients and the healthcare workers, and to other allied healthcare workers. So first, let us define what is communication. Communication, it is the exchange of information, a message sent, received, and correctly interpreted by the intended person. So for example, I am the sender and the patient is the receiver. The information I sent to the receiver is called the message. So message, and the information returned by the receiver to the sender is called feedback. So these are the four elements of communication. Always the communication should have four elements. So first is the sender, second is the message, third is the receiver, and fourth is the feedback. So this is the image. So we have different methods of communication. We have verbal communication and we have non-verbal communication. So if we're talking about verbal communication, guys, it involves the use of language, either spoken or written. Okay, for example, you tell to the patient that you're going to have a surgery tomorrow. So you need to have fasting, or you need to do NPO, or nothing per RM. So that's verbal communication. So the patient will tell you, okay, understood. So that's verbal communication. So non-verbal communication, on the other side, a person gives information through the use of facial expressions, gestures, body language, and tone of voice. For example, you're taking care of a patient who has post-surgery, okay, this appendectomy, okay. What is post-appendectomy? Operation after operation of the appendix, removal of the appendix. So your patient, you saw the patient that she has facial grimace, okay, but she's not talking. She has only facial grimace because what? Because of pain, because post-operation. So that is called nonverbal communication. That uh, that data is very clear that the patient is having pain. So you need to give a pain medicine, or you should inform the nurse to give pain medication, or you need to do a non-pharmacological intervention, like distracting the patient from the pain, like allowing the patient uh, to engage in activities like music therapy and other non-pharmacological activities. Okay, next, strategies of effective communication. What are the things we need to do to be an effective communicator? First, when you are a receiver, be a good listener. Okay, it's not good that uh, you are only the one communicating or talking. You should always be a good listener, especially if we have patient who is depressed. The patient needs you. Okay, listening is uh, is a way to help your patient to ease their anxiety, to ease their depression. Even if you are not talking, as long as you're there, the patient will appreciate you. The patient will think that you are available to hear, that you are concerned to him or her. So that's how important to be a good listener. When you are a sender, make sure your message is clear. So it's this second one, it's quite difficult because most of us, not all of us, came from the same country. So you expect that we have different way of talking, of communicating. So it's very hard to give a clear message, but you need to ensure, even if it's hard, that you are giving a clear message, especially when the nurse is instructing you to do a certain procedure. Okay, you need to make sure that the message is clear, so you will prevent mistakes. You will do the right thing. Third one is wala. Third one is wala. Sorry guys. Saan na ba siya? Learn techniques for encouraging people to talk. Some patients, especially depressed patients or those with general depressive disorder, they will not talk. Or those patients with bipolar disorder, if this patient is in the depressive state, they will not talk. They don't want to communicate to others. They want to be alone. So you need to learn techniques how to encourage them to talk, because some of them they will not talk, some of them they will commit suicides. So make sure you monitor these patients. Okay, and what are the techniques to encourage people to talk? We will discuss it later on in therapeutic communication. Number 4, you need to provide and seek feedback. Okay, you need to seek feedback to make sure or to evaluate if the message is clear or if they understand what you're talking about. Number 5, be mindful of your body language and tone of voice. Some of us, some of us, even if you don't want, even if it's not our intention, we are doing, we have different body language, or our voice is uh, high, or we have different different ways on how we communicate things to others. So the patients or the other healthcare workers will misinterpret that. So be careful with this one. Lastly, remember the value of silence and comforting touch. So these are an effective therapeutic technique on uh, how we will talk to the patient who is depressed, anxious, emotionally disturbed. But not all patients consider this comforting touch. Other religion or culture don't believe in comforting touch. So always be careful. So how we will communicate? For example, our patient is blind or visually impaired. What are the things we need to do? First, we need to knock on the person's door or tell him right away that you are there so that you don't startle him. So describe the person's surroundings and tell him what is going on. So you need to orient the patient about the patient's surroundings. So she will be aware that this is her kitchen, this is her bathroom, this is her living room. As you move through a skill, describe each step as you are doing it. For example, when you're using an equipment, describe it to the person. If it doesn't cause an infection control risk, and if he is interested, let him touch what you are holding. So he will be aware is that uh what are you talking about. When helping the person move around, encourage him or her to hold your arm just above your elbow. Okay, always do this to make sure that you are supporting the patient. Always approach the person from front and gently touch the person on the hand or arm to gain the person's attention. So this is also a way to not startle your patient. Be aware that hearing impaired people often learn to read lips and rely on watching your mouth move. So these are the techniques how to communicate with hearing impaired patient. So they are basing their interpretation on the mouth, on your mouth. When speaking with the person, position yourself so that he can see your mouth and facial expressions. Pronounce your words slowly and clearly and speak in a short sentences. If the person does not seem to understand what you're saying, change your words, but do not change the volume of your voice because he will tell you that why are you shouting? Always use a moderate tone of voice. And when you're talking to this patient, always reduce the background noise to make sure that he will hear you clearly. Use gestures to help explain what you are saying. Gestures is a good way to explain what you want to say. And how about when you're communicating with the family? Family is very important in getting uh, patient's data. For example, the patient is not talking or the patient don't want to talk about her situation. So the family is the right person or the right people to talk to about the patient's condition. So how you will communicate with the family? You can help family members feel more comfortable by explaining your role in providing care and explaining why you do things in a certain way. So at first, to gain the trust of the family, you need to to introduce yourself with the family to gain their rapport. Rapport, it is a trusting relationship. So the relative will touch you. The family will trust you. So in this way, you can get information from them to help in diagnosing the patient's condition, or the to help the nurses in creating their care plan for the patient. So if you are close with the family also, if you are good with the family, they will, I'm always telling this to my student, they will not uh, disturb you. They will not be demanding to you, because if you are good with them, they will keep this keep that in their mind, and they will not disturb you. So whatever you're doing in the hospital, taking care of other patients, if you are good with them, they will not disturb you. So you should always be kind with the patient and also with their families. Okay, let's go with communication in healthcare team. So these are the group quiz that we had last Friday. So we have the medical terms, the medical abbreviations, the directional terms. So we should know all of this. Why? I'm not doing this just to punish you or to make things hard for you. I'm doing this because you need it. Because when you went in a hospital, when you go to the hospital and you don't know what is the meaning of appendectomy, okay, what you will do, the nurse will tell you, can you tell the patient to have an NPO diet because he will have a appendectomy tomorrow. So you're just you're just looking at your nurse and you don't know what is appendectomy. So medical terms, memorizing medical terms, familiarizing yourself in medical terms, and abbreviation is an important way to understand more, to communicate well in the healthcare facility. So as you can see, medical terms, it is derived from a root, prefix, suffix, and a combining vowel. So for example, in medical term, we have the term cholecystectomy. Cholecystectomy. The whole meaning of cholecystectomy is removal of the gallbladder. So what is the root word of cholecystectomy? Cholecyst. What do you mean by cholecyst? Gallbladder. The suffix of cholecystectomy is ectomy. Always remember, when you're talking about ectomy, it means removal of. Removal of. So if you hear ectomy in any word like appendectomy, it means removal of.